The CDC is reporting an increase in COVID-19 hospitalizations just as students head back to school. This as vaccine makers Moderna and Pfizer now say lab studies show their upcoming boosters help offer additional protection against newer COVID subvariants. Let's bring in ABC News medical contributor Dr. Alok Patel for more on this. Dr. Patel, how concerning is this rise in COVID cases as kids go back to school? Put this in perspective for us.
Well, Diane, with kids going back to school, a lot of parents out there know that they're going to potentially mix germs. And this is not only related to COVID, RSV, and influenza, but also the common cold or enteroviruses, as some parents grudgingly know as hand, foot, and mouth disease. Now, what is concerning is that we see a 20% rise in hospitalizations, which is lower than it was last year, but that's usually a lagging indicator of what cases look like if people were to test positive. We aren't even counting those numbers as well. So I don't think there's any need for panic, but parents should be aware and remember the basics still work in terms of masking and keeping your kids home if they have any symptoms.
So what's the latest guidance on how to get tested, and what do you do now if you do test positive? What are the restrictions and guidelines?
Well, not a lot has changed in terms of what you should do if you test positive. So even with the new circulating strains, if you test positive on one of those home antigen tests, you should assume that that's positive. Take any precautions you may need, especially if you're high risk or around people who are high risk, but also you need to isolate for 5 days. That is still the same. If people out there have questions about what to do, if they've been around someone or they've been exposed, there is a very convenient calculator online. You go on the CDC and you type in your information, and it'll give you guidance on what you should do. And one other note, a lot of questions out there about what to do with tests if they're old or expired. Go online, look at the FDA's website because they just expanded the expiration date for several tests. So those tests you may have in your bathroom drawer, they might still be good.
All right, and vaccine manufacturers now are saying these lab studies show the upcoming boosters help offer more protection against newer subvariants. So what does that really mean, and when will these new boosters be available?
This is the art of trying to match a vaccine with dominant circulating strains. If this sounds familiar, it's what happens every year with the influenza vaccine. So this vaccine, which we should get some details and a potential approval next week, were designed to match XBB, the most dominant strain of 2023. Now, the strain that is circulating most dominantly now, EG5, is part of that subvariant family. That's what scientists are looking to study. And what we're waiting to see more data on is how well this new booster does against BA.286, which is that variant that people are keeping their eyes on to look to see if it could spread more easily or evade previous infections. But this is really important news for anyone to pay attention to because a lot of the protection we have has waned since people got their last booster.
Meanwhile, the CDC has issued a health alert on an increase in RSV in parts of the country. Who's most at risk, and who should consider getting a vaccine for this?
Yeah, this health alert had every pediatrician's eye rolling. We're like, oh my gosh, RSV. So basically, there is a little uptake in the Southeast, which may signal the start of the RSV season. And if you remember from last year, we had an early RSV season with cases spiking in November, which is usually earlier than it usually does. So what people should pay attention to is that this is the first year when we will have protection against, in terms of a vaccine or drug, against influenza, RSV, and COVID. So with RSV, infants 8 months and younger, pregnant women in their second trimester, and older individuals are those who will have a vaccine or drug available to them. People should pay attention to that because every single year, a good year or a bad year, RSV hospitalizes thousands of Americans and kills, unfortunately, many of Americans, especially those who are high risk.
All right, Dr. Alok Patel, we appreciate your analysis as always. Thank you.
Appreciate you, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.